PPE, personal protective equipment, we hear this word all the time, but what does it really mean? So personal protective equipment are physical coverings. They're physical barriers that we wear as health workers on our body to protect us from infection and to also protect our patients from infection in the event that we are sick. Right now with COVID-19, we know that there are lots of patients and health workers that are getting COVID, and so wearing personal protective equipment just protects all of us. The most important thing you can do as a health worker when you're dealing with a pregnant patient is to perform a risk assessment before you put on PPE. What is a risk assessment? A risk assessment is an evaluation that a health worker will do every time before they put on PPE, where they want to assess what is their risk of exposure and the extent of that exposure to bodily fluids, blood, respiratory droplets, which is particularly important with COVID, and open skin. So basically, it's like a mental evaluation we want to do as a health worker to try to assess what is our risk of being infected with some type of microbial infection or pathogen when we're giving care to a patient. This assessment will allow us to then pick the PPE that's most appropriate for our assessment, for our patient care. The PPE will also require us to perform hand hygiene, and risk assessments should be done for each patient each time for all maternity settings. So the PPE that we are going to wear in an antenatal clinic providing routine care to a pregnant patient will be different from the PPE that we will select from a pregnant patient that is starting to deliver a baby, right? Okay. So these are examples of the different type of PPE that we are using for COVID-19. Again, the PPE that we select will depend on the risk assessment that we're providing routine care. We may not need a face shield, for example, right? If we are at risk of having bodily fluids splashed on us, particularly if we are having an obstetric emergency, or we're in the surgical theater, or maybe a mother is having severe complications in the delivery ward, then we might have to do a different risk assessment and realize, wait a second, we actually need a face shield. But for right now, the current recommendations for PPE for a COVID patient, either a suspect or a confirmed case, are these items: a gown for your body, gloves for your hands, a medical mask for your nose and mouth if you are providing routine care. So if we have a pregnant patient coming to antenatal clinic and we're just doing routine care, we only need a medical mask. We also have respirators or N95 masks, which we will use for our pregnant patients if we are doing what we call an aerosol generating procedure. An aerosol generating procedure is, for example, like intubation, a bronchoscope, any type of lavage, anything where we run the risk of having droplets aerosolized into the environment. We would want to use an N95 mask. So in the antenatal clinic, the likelihood of us using an N95 mask is not very likely, right? We would generally be using this N95 mask more in the inpatient settings, but not always. You would have to do a risk assessment to see if you're going to need an N95 mask. But for the most part, in an antenatal clinic with routine care, you're not going to be doing an aerosolized generating procedure. You would need a face shield if you're going to come into splashing of bodily fluids, and or goggles to protect your eyes. This is the recommended PPE that we are using for COVID-19. Now, when you're putting on and taking off protective equipment, there's a very specific order. The first thing that you do is you perform a risk assessment, and let's say, okay, you decide that you have a COVID-19 patient, okay? Or you have a COVID suspect. You realize that you need to put on a gown, you need to put on gloves, you need to put on a face shield or something to protect your eyes, and you need to have a mask. So because we're talking about antenatal clinic, we're gonna talk about a medical mask, okay? So you're gonna put on those 4 items, and then you're going to perform hand hygiene. The one thing you want to do is make sure that you wash your hands, because all PPE should be sterile, ideally, okay? If the PPE is maintained in good condition, if the PPE is stored in a dry, clean, cabinet or storage area, PPE shouldn't have any microbes on it when we put it on. So we don't want to introduce any PPE, any microbes on our PPE when we're putting it on. So the first thing that we do is when we're putting on PPE is we put the gown after we've washed our hands, okay? After we've put on the gown, the next thing we're gonna do is put on the medical mask. And again, we would use a medical mask for routine clinical care and an N95 respirator for more inpatient aerosolized generating procedures. After we've put on the medical mask, we can put on the goggles or face shields, depending on what your health facility has available. And then last but not least, we put on our gloves. Why do we put on the gloves last? I get this question quite frequently. Why would we not put on the gloves first? Who can answer for me? I'm sorry, I'm not trying to give you an examination. Not trying to give you an examination, just trying to get us thinking and engaging. Exactly. So remember, the gloves, in theory, are going to be the thing that's going to touch the patient the most, right? Because you're going to be touching the patient directly with your gloved hands. So the gloves we put on last because we don't want to run the risk of contaminating them by putting them on first, by putting on the other PPE or potentially touching any other surfaces with them, okay? The one thing that's very important that I like to emphasize is that the order that we put PPE on is very important. But the order that we take it off is even more important, okay? The reason the way we take it off is more important is because during an epidemic, this was very true during Ebola, and we don't have the research yet, but I feel quite confident it will be very true of COVID-19. More health workers become infected when they are taking off their PPE with the virus. That is because of a couple of reasons. One, you're tired, right? You're tired. You're hot. PPE is very hot. And in a lot of our healthcare facilities, we don't have air con, and we're in PPE sometimes for hours, right? Taking care of patients. You're hot, you're tired, and you're dehydrated. So what do people do when they take PPE off? They do it too fast. When you take PPE off too fast, you run the risk of making a mistake and then potentially infecting yourself. Who can tell me during the time when you're taking your PPE off, who can guess when most healthcare workers get infected? when they're taking off what PPE item? Is it the gown? Is it the face shield? When do most healthcare worker infections occur? When people are taking it off. I see gown, I see gloves, I see face shield, I see mask, I see all of it. Okay, it's when you're taking off your mask. Why would that be? Why are you as a health worker most vulnerable to COVID-19 and other types of infections when you're taking off your mask? Well, number one, it's the last thing we take off, right? And because it's the last thing, we are ready to get the heck out of that mask, right? We want to get that thing off. We want to breathe. So we're in a hurry. And how many times, I don't have to tell you, how many times have we taken off a mask, either a medical mask or an N95, and we're in a hurry, and then ladies, gentlemen, it gets stuck in our hair. It gets stuck on our ear. It gets stuck around our neck. And then what happens? Immediately when the bands of the mask get stuck on our ear, stuck in our hair, it's human instinct to let go of the mask. Well, what happens when you let go of the mask? It flicks, right? It flicks on your face. It hits the side of your cheek, it hits your neck, it hits your ear, the mask gets caught in your hair, and then what happens? We potentially are releasing virus from the mask. Meanwhile, you've taken a deep breath in because you're hot, you're tired, and you're sweaty, and you've potentially then exposed yourself to COVID-19. Okay, so let's go through the steps of taking off PPE because the steps of taking off are even more important. So you have finished taking care of your patient. You want to remove your gloves first. The same rules apply. Your gloves are now the most contaminated part of PPE that you have, in theory, right? Because you have now touched your patient, you've maybe touched a stethoscope, you've touched the bed, you've touched the rail, all those things. Next thing you want to do is remove your gown. And you want to remove your gown from the outside in, okay? It's a technique where you kind of flip the gown inside out. So that way you keep the inside, which is clean and has no virus. That's the part that you expose to yourself. After you've taken off your gown, because you've potentially touched your gown with virus, you want to wash your hands. After you've washed your hands, because your face is the most protected area and the area that we want to protect the most from the virus, after you wash your hands, you can remove your goggles or your face shield. Then you remove your medical mask, and then you perform hand hygiene again. And those are the steps for donning and doffing PPE for COVID-19. I just wanted to show you again, here's another, whoops. I don't know why this does this. It's making me crazy. So, I don't want to jump around too much, but if you are taking care of a patient and they have respiratory symptoms and you're in the antenatal setting and you fear they are a suspect, okay? These are the PPE that you are going to want to put on. Now, first and foremost, you're going to want to make sure that that person, that patient with respiratory symptoms is separated as best as you can from other patients, right? So you're going to want to make sure that you can separate them away from other people as best as you can. If you cannot remove them and put them in a completely separate space, then at least make sure that they are 1 meter away from other pregnant patients and you have a medical mask on that patient, okay? And then you, as the health worker, will want to put on these 4 types of PPE: a gown, a medical mask, goggles or face shield, and then gloves. Remember, For routine patient care for COVID suspects, you do not need a respirator, okay? Remember, COVID-19 is droplet precautions. Droplet precautions. Think of other types of infections that require droplet precautions. C. difficile is a very good example. When we have a patient with C. difficile, do we use respirators when we take care of them? No, we use medical masks, okay? Now, this is stepping a little bit outside of the antenatal setting, but I want to emphasize the difference. If you are in a situation where you have a COVID-19 suspect or a case that is requiring an aerosolized generating procedure, then you use these 4 types of PPE. So the gown, the goggles or face shield, and the gloves stay the same regardless of the type of patient. The only thing that changes is the mask. If you run the risk of doing an AGP, then you must wear a respirator. But as I mentioned, in antenatal clinic, we're not going to be wearing, we shouldn't be doing AGPs in antenatal clinic, okay? But I just wanted to emphasize the difference because a lot of people get this confused. I know lots of countries are making blanket recommendations about wearing respirators when we don't need to be wearing respirators, okay? Now, here are some general rules for wearing PPE. I know that we're getting a little bit short on time, so I'm not gonna read all of this, but I want to just highlight a few things. You always have to put PPE on before patient contact. I know it might sound like a very obvious thing and you'd be like, Ebeth, girl, you're crazy. Of course I know that. But remember, how easy is it for us to take off gloves and then a patient says, can you help me 1 second? And how many times have we gone over there and touched another patient after taking off gloves and not washing our hands? We've all been guilty of doing it, okay? I'm not punishing or criminalizing anyone here, but during an epidemic and a pandemic, we have to be hyper vigilant and not do those activities, even more so than normal, okay? If you are using disposable PPE, it should never be reused, okay? Only if PPE can be disinfected appropriately between uses should it be reused, okay? Now, I know in our region, we have a lot of PPE shortages and a lot of people are wearing masks for longer, they're reusing things, all these types of things that are happening. But I just want you to know that remember, if you're reusing PPE that can't be disinfected appropriately, you're just directly putting yourself at risk. So that's why we want to make sure that if we can disinfect, we do. If we can't, we don't. Before you put your PPE on and while you put it on, you want to make sure that you don't have any tears or that the PPE is not compromised. I can't tell you how many times during the Ebola epidemic I would find nurses that I was working with and doctors in particular too, where their PPE would have a cut and they would walk right into the patient area. And I would say, wait, you've got a hole in your PPE, you've got a hole in your gown. Come back, take it off, start again. The most important thing I have to say to you about wearing PPE during COVID-19 with our pregnant patients is, once you've put PPE on, you cannot adjust it. Do not touch it. You run the risk of self-contamination, especially your mask. Once you've put the mask on and it has been fitted and it is comfortably on your face, if you start to have glasses or goggles or face shields that start to fog up, do not readjust the mask, do not readjust the face shield, take off the PPE and start again. I cannot tell you how many times I see healthcare workers wear their mask underneath their chin or wear their mask underneath their nose, and they'll walk in the hospital corridors and they'll have the mask on that way, and then before they go in to see a patient, they'll take their bare hands and they'll put the mask back on top of the nose. You've just potentially contaminated your hands with any COVID-19 virus that was on the outside of that mask, okay? I'm going to skip safe injection safety. The rules here are pretty straightforward, but there's also, I want to focus more on environmental decontamination quickly, okay? So decontamination is an umbrella term that refers to the removal of soils or organic microorganisms from objects or surfaces, okay? Cleaning, disinfection, and sterilization are three different processes that we can use to effectively disinfect, clean, and sterilize our hands. These are the three definitions. Similar to the three different mechanisms of hand hygiene, these are the three different mechanisms of decontamination. The first one is cleaning. Cleaning is the physical removal of foreign material from a surface. It can be blood, it can be secretions, it could be dust, it could be soil, it could be anything that the patient has potentially left behind on linen or on an environmental surface, okay? We have to clean before we can disinfect. Disinfect is the process where we reduce the number of viable microorganisms. So this is the process whereby we inactivate the microorganism. And then sterilization is a very specialized process that we do a lot, mostly with medical devices that have come in contact with bodily fluids, to make sure that those devices are rendered microorganism free. They do not have any microbes on them, okay? What are administrative precautions and environmental controls? So we're gonna move a little bit now to looking at a different subset of IPC precautions that have a lot to do with sort of incorporating changes into the healthcare facility that are aimed at changing behavior, okay? Administrative precautions are those that we implement during an acute emergency that force patients and health workers to modify their behavior in order to reduce the transmission of microorganisms in the healthcare facility. Environmental controls are one set of practices that we use to be able to effectively implement administrative precautions. So during COVID-19, we may reorganize our labor wards. We might reorganize the way we have our surgical theater set up, right? To be able to sort of modify our behavior and to remind us, wait a second, before I go in and do this C-section on this pregnant patient, I need to make sure that I have X, Y, and Z IPC precautions in place. And we might make sure that we remind ourselves to do that by modifying the physical environment. Here are some examples of administrative precautions for COVID-19. I'm not going to go into these too much. I'll let you read these, but they can be anything from making policies to making trainings to making SOPs, things of that nature, okay? But one of the most important things in our antenatal clinics is that we have effective triage, because triage is the bare minimum. We want to prevent COVID-19 infections from entering our healthcare facilities. So we want to make sure that we screen pregnant patients long before we allow them to come into a waiting area or the healthcare facility. So this on this screen, this is displaying the bare minimum equipment that is needed to set up a triage station at your healthcare facility. One thing I always like to emphasize to people in my trainings is that you can set up triage with just these minimal resources. You do not have to build a brand new building. You do not need a tent. You do not need a lot of fancy infrastructure to set up triage. Triage can be as simple as 2 chairs and 1 table, okay? If you need it to be outside under a mango tree. Triage does not have to be a sophisticated system. It does have to be a system where you can actively screen pregnant patients before you let them into the clinic, okay? This is a very basic triage setup, okay? Incorporating those minimal requirements that I showed you on the other slide, all right? I'll let you look at this yourself because I know we're running a little bit short on time and I want to save some time for questions. Here on the next couple of slides are the 11 steps that you need to actually set up triage, okay? That's how you would do in your healthcare facility to actually set up a triage station if you don't already have a station set up. Now, questions that I get a lot right now during COVID-19 are, what are the PPE requirements for triage and for screening pregnant patients? Well, if you are a health worker that is going to be working in triage and you can keep at least 1 meter distance between you and the patient, then you don't need any PPE. If you are not going to be within 1 meter of the patient, you're not going to be doing any physical contact with the patient, and you're not going to be doing any care, you don't need PPE while you're in triage. If you have a triage station where it is not feasible for you to physically distance yourself at least 1 meter and there's no patient contact, minimally, you want to use a medical mask and gloves.